So let's just get right to it. What are you cautious about, if anything, when it comes to either using Ozempic or Wegovy for weight loss purposes? So something that isn't necessarily what it was kind of built to treat.
No, absolutely. And we see Ozempic, Wegovy, and Mounjaro. And Ozempic and Mounjaro have FDA approval indications for type 2 diabetes. So Wegovy is the only one really with an FDA indication for weight loss. But all of these drugs work the same way. These are glucagon-like peptides that impact the reward centers in our brain and has some control and modulation over reward and satiety. And so we see an extrapolation and we hear the chatter from patients and from physicians regarding a decrease in alcohol intake. We also see in mice studies as well that it can impact cocaine use, amphetamine use, and also nicotine, and some controversial data on opioids. But again, this is not human data.
Right.
This is data on mice, and we've got to have those human clinical trials.
And that's really important to note there, because what we are seeing are just, purely anecdotal. People are saying, hey, I kind of, don't really have an appetite for alcohol anymore. Not necessarily one size fits all for everybody. Do you have any concerns, though, when it comes to this? Because when this whole thing kind of started with Ozempic, there were people, diabetics, that said, hey, I can't get my medication anymore because so many people are getting this drug and they don't necessarily need it for diabetes. So do you have any concerns as far as that goes?
Not only do I have concern about access for people for whom it's really indicated, I also have concern with regard to what we've noticed when people have stopped taking these drugs, and that is that their appetite returns with a vengeance and the weight comes right back. And so are we really trading one addiction for a lifelong dependency on something else? The other thing that we don't have information on yet is with regard to long-term use of these drugs. Does the effect begin to wane after a period of time? All of this is why we need to have human clinical trials and not just rush right out of the gate. But certainly we see promising results, and we also see results with regard to sexual behavior. Again, in mice. I want to be clear, I'm not talking about humans. This is preclinical mice data, that there is some curbing of sexual behaviors and pre-sexual behaviors. And so possibly there could be some use even in criminal and predatory situations where these drugs have even far-ranging use. But we're way out ahead. We've got to get these human clinical trials. We see Novo Nordisk is running clinical trials, University of North Carolina, and so we must await that data. At this point, these drugs are being used off-label if we're using Ozempic, and the Mounjaro, Wegovy is the only one that's FDA approved for weight loss. Pfizer is coming out with a pill.
That's right.
Also, in this same category, it will have a dual action, and so possibly maybe could even accelerate further weight loss. And as an oral supplement will be easier to take than these weekly injections. But again, that is not yet available and is not yet FDA approved, but on the horizon. So science marches on, and we have to figure out how to manage it and stay ahead of it.
And really quickly, we're just about out of time here. Obesity is such a problem in our country right now. Is this just another tool in the toolbox that you think that we'll have eventually, or do you think that, there's still issues at the core of our society when we're talking about accessible, healthy food, things like that, or is this kind of a crutch to say, maybe we'll put a Band-Aid on the problem now and then maybe it'll get fixed later on?
Yeah, I think this is going to be a critical question to be answered, and certainly obesity is a major problem in the United States, and it leads to heart disease and diabetes and hypertension and all of these other things as we're seeing our lifespan decrease over the last few years. Successive generations now are living shorter amounts of time than previous generations. Obesity seems to be at the core of that. So it remains to be seen whether this is going to be a crutch or whether this is actually going to be the first tool in our armamentarium to begin to move towards that. Certainly behavioral factors as well as genetics will be at play.
All right, Dr. Jane.